This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome. It's Health Watch time. It's healthy time. It's time for us to start the show. Every Sunday we're here, Health Watch 8 till 9 on Talk Radio 1210 WPHD. And as you heard the man say, Health Watch features Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We'll talk about the who, what, when, where, why, and how of Innovative Medical and how they can help you, and a variety of things that you probably don't know about. It's all right here on Health Watch from 8 till 9, right here on Talk Radio 1210 WPHT. Before we get into the show, Dr. Molly, you have a shout-out?
I have a shout-out. This is an interesting shout-out. It's for Sam the Third and Sam the Fourth. But Sam the Fourth is the young man who came in, and he's repping a company called Pharma Nutria. And Pharma Nutria is an Italian product. They have a very slim line, but I love these products because of how they really are digested in the body. And at some point, you and I are going to have a nice show about that. But again, you know, Molly doesn't like to have oral products. I don't stock them. So I'm very impressed with this company. And of course, I got to say, John, because you and I are Italian, maybe I'm a little biased.
Right.
Okay. I don't like to say that, but maybe I am a little biased. But no, actually, the science is outstanding. So thank you, Sam. God bless you.
And rarely do you recommend products.
I know. Not oral. Yeah, I show them brands. And you know I have to love a brand to even say this on radio. So.
Okay, we are here on Health Watch, and the number here in the studio, 855-839-1210. That's the number, 855-839-1210. Anytime during the course of the show, if you have a question or you have a medical challenge for Dr. Molly, feel free to call in, 855-839-1210. All right, Dr. Molly, we always put you on the spot. We always
and it's a good spot.
We always ask you, what exactly do you do?
You know, John, every week when you ask me that, I'm always, I hear people say, why do we have to hear that again? Well, because of all the listeners out there who haven't heard it once or twice or three times and still don't understand it. It's a very unique concept. We are a group of like-minded healthcare providers who work out of my facility that is a primary care licensed facility. So what does that mean? That means we can do anything that any other primary care doc can do. We can order blood work. We can write prescriptions. We can send you for radiology. We can refer you, which is unique today, the way things are, refer you to another doctor for a specialized kind of exam. So these are the things we can do. But our philosophy is what really sets us apart from other places, because we like to use the least amount of pharmaceutical to help a patient with their medical challenge and thereby eliminate the side effects, not only from their challenge, but from the medications itself. So that's a big difference. And how do we do it, right? Hydration therapy. And John, the more and more we talk about hydration, the more and more I know how important it is. It seems to me that there has been a run-on in the emergency rooms and in the urgent cares for more and more hydration. So this is something philosophically we already know about. Imagine having hydration with then the particular substances that can help you with your particular challenge. That's not always done when they're just doing hydration.
When it comes to hydration and when it comes to a person starting with you,
sure,
Where do they start with 5 treatments, 10 treatments, 20 treatments?
It could
How
be.
does
It could be 5 treatments, of course. What happens is that you have to come in, speak to me, tell me what's going on. Of course, we're going to get together. You know, I have weekly meetings with my docs, particularly more sometimes about certain patients' conditions. It depends on where you come in the continuum of your particular challenge. For example, if you come in stage 3 cancer, obviously you're going to need more often than someone who comes in for a tune-up post, let's say, post-appendectomy, right?
You have people that come in for tune-ups. Then you have people like myself who come in forever.
Well, you're a lifer, John.
I'm a lifer. And then you have people that come in once in a while.
Right.
What's the barometer? How do you figure this out?
The barometer really is what's going on for a particular patient. When you have a patient that has a multitude or several underlying conditions that are contributing to his overall bad quality of life, hello, John, you need to make sure that we address each and one of those. And we may not be able to address everything at once. That, my friend, is the problem.
And so what you do is take it one at a time.
Right. So you come in twice a week because we're looking for both diabetes. We look for particular cancer markers because you have had a couple of bouts with cancer, as well as the cardiac issues. So again, and I can tell you overall then we see a combined type of treatment protocol that works for you and keeps you, I hope, as healthy as we can.
Is there one particular condition that you have had more success with than others?
Well, I think the longest condition that we've worked on, of course, is the cardiac and the lipidemia, meaning high lipids. But we've done that for 27 years. And I believe that we've actually had improvements in the original recipe that is out there that people are just getting into now. I mean, that's old hat to us. But I would tell you that we're seeing also more and more chronic conditions, and I have a lot to talk about in that vein later today. The chronic conditions worry me, and by that I mean chronic autoimmune conditions. I'm seeing more and more patients who are coming in with autoimmune of unknown etiology, and it's like, okay, but I feel lousy, but I don't have a diagnosis, and that takes a lot of work on our end.
And then, of course, you have the serious cases.
Oh, my goodness.
And I tell you what, you know, I've said this before. If I don't feel depressed or anything, I walk into your place and I see some people who are really, conditions are not exactly
the cancer
ideal,
conditions and the some life-threatening and life-eroding. That's my new thing, life-eroding conditions. In other words, you're not in a life-threatening situation in that moment. You can sit in my chair, you can but overall, your quality of life is down the drain.
And you have dealt with those kinds of cases.
Oh, my goodness, yes.
And obviously there's more that you have to do.
Well, right. That takes a little more time and a little more effort to put together a protocol for that particular patient. But, I got to thank God that my physicians, because of the varied background, I have an anesthesiologist is our medical director, and I have a woman's health physician who really is pretty sharp in terms of some other things. So the bottom line is that altogether, the teamwork is what helps our patient. But I would say that I, in turn, spend a lot of time on the science of what is making this person have less quality of life than someone should have at their age.
And we have talked about this many times. You have over 600 protocols.
True.
And the key to the protocols is the synergy of one
one
ingredient versus the other.
nutraceutical to the other, and what possibly to leave out. There's a million of these hydration protocols that are out there. Most of them are very simplistic. Somebody comes in with a hangover, you give them a banana bag. Everybody knows that, okay? You don't have to be a genius for that. But isn't it interesting? Someone comes in with a migraine. Do you give them a banana bag? Well, I heard that that's exactly what they do. That may work, but there's so many other things that you could add to that bag that may enhance the idea of eliminating the particular migraine, but more importantly, helping the patient not have them on a repeated basis.
Well, like what would you add to that?
Well, come on.
Without-
That's
without-
the secret
without-
sauce. Well, everybody thinks about just magnesium is one of them. I mean, trace minerals make a difference, but there's some other things that are neuro enhancers. For example, neuroamino acids. I might want to look at one of those for a particular patient. So it really depends on what we're trying to do, John, and every patient is different. Every patient. Conditions can be like and similar. Doesn't mean that the patient metabolizes the nutraceuticals in the same way.
And, many people say, how come my bag is orange and
Oh,
your bag
well,
is yellow?
yeah.
And
How about blue? How about blue?
Yeah.
Right. Okay. So
what does that all mean?
that all means that it's just putting together the various nutraceuticals for that particular patient, for his particular condition, and where he is in his particular continuum.
The question always comes up in an initial consultation. People will say to you, yeah, but Dr. Molly, this sounds all wonderful, but does it work?
Come on in. Talk to everybody. John, you're there every week, just about. Every week,
right.
except when you go on vacation, which I want you to do. You see the people. You see. You cannot. You can talk placebo from now till forever. Bottom line is the patients themselves will tell you, but we can generally see a change, qualitative change as well as quantitative, meaning in the blood work, in the lipids, in the blood pressures, these kinds of things that we write down and actually have in the chart in as little as 5 treatments, which would be 5 weeks if they come in once a week or so.
That's incredible.
It is incredible.
It
is incredible.
That quickly?
Yes, it doesn't mean we've cured the condition. I want to make that clear. I don't ever claim to cure anything, but I'll tell you one thing. We can improve your quality of life. And in most cases, it's the quality of life issues that really put people under the weather. It's not necessarily a treatment. And a good thing to talk about in that is the cancer protocols.
Yes, because
the treatments can be as bad as the condition, or maybe worse.
Right, and you, of course, have helped many cancer patients.
Yes, and I'm going to talk about one when we're at the end of the show.
Okay. We are coming up on our first break of the morning. The show is called Health Watch. Every Sunday we're here from 8 till 9 on Talk Radio 1210 WPH.D. Dr. Molly Fantasia is here, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. 855-839-1210 is our number here in the studio. If you have a medical challenge you want to run by Dr. Molly, or if you have a simple question, feel free to call in with that, 855-839-1210, 855-839-1210. Dr. Molly Fantasia and yours truly, your host, John DeMasi, will return with more of today's Health Watch after these words. We are back here on Health Watch. Operators are standing by, as they always are, when we're here on the radio, and they will be there well after we leave you at 9 o'clock this morning. And the number at Innovative Medical Associates is 856-489-0505. 856-489-0505. When you call, the best thing you can do is set up an appointment with Dr. Molly for the initial consultation, which is complimentary, and you will learn a lot about your condition, your problem, how Dr. Molly potentially can help you, and you'll just be able to make a more intelligent and effective decision moving forward. 856-489-0505 and the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Our show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. We're going to go to the phones. We're going to talk to Catherine in Philadelphia. Catherine, you're on with Dr. Molly. Good morning.
Good morning, Catherine. Good morning.
Good morning, Dr. Molly. How are you feeling?
Good, good. How you doing?
I feel lousy, Dr.
Oh,
Molly.
man. Come on. Tell me what's going on.
I have a horrible, it's all in my ears, nose, and throat, head cold.
Yes.
I don't know how to shake it, Dr. Molly. I've been taking green tea, dandelion tea.
Good. Hey, Catherine, are you sure it's a cold, darling? Are you sure it's a cold?
It's not COVID. I tested for COVID.
I believe you. I believe it isn't COVID. But, this is an interesting question that you posed to me because you can't shake it. So this is exactly, John knows this is exactly where I was going today. Because symptoms can be, listen, this is very interesting. I'm sorry you're having such a hard time. Symptoms can be really a double-edged sword, On one hand, you think that's what you have, right? And you're having these symptoms because normally it ties into something as simple as a cold. But what if, on the other hand, it's a symptom that is totally separate and maybe something else is going on? And that's why.
That's what I think, Dr. Molly.
Yes,
you're right.
that's
It's
what
not,
I
maybe
think
it
too.
is.
And maybe it is. And let me tell you a story. I am finding more and more people who are coming to us with symptoms like that, and what they're having is the body's response to environmental, like mold and maybe some toxic chemicals, anything that can start the body into what? Inflammation. It sounds like you're having an inflammation process. So I'm wondering, do you think you could have been exposed to mold or some other type of environmental issue, honey?
I mean, you don't have to wonder, Dr. Molly. It's true. I live next door to a house that has 65 bags of trash in it.
Oh my goodness.
Needles and this and that. That house should be knocked down, Dr. Molly.
Oh, my goodness. Oh, my goodness.
Awful.
So, honey, I don't
Believe
think
me.
it's a head cold. I don't think it's a head cold.
Even affecting my animals because they're not feeling well. They're coughing and hacking and whatever.
Right. I really think it's important that you get to somebody to see if they can find out what the underlying cause is. And therein lies the rub, because the symptoms you're experiencing, and I bet you're experiencing more than what you're telling me. I bet you have more like asthma, maybe some chronic inflammation, like you're feeling like your joints. Are you feeling bloated, upper respiratory?
Joints.
Yeah.
Bloated, absolutely.
Yeah.
Everything you're saying, Dr. Molly.
Difficulty breathing, I can hear it. I really feel you've got to get in and get some traditional blood work, some traditional screening, and you cannot allow the doctor to tell you it's just a cold. Okay? I mean that. I don't like the way you sound. I can hear it, Catherine. Please, get into. Do you have a family doctor, honey?
My cousin is an infectious disease doctor. He
Good.
wants to speak to my doctor on Monday.
See? I love you, Catherine.
Because he's saying the same thing you're saying.
It's some kind of infectious disease. Now, I will tell you that I'm seeing a rise. This would be interesting. Talk to your cousin. I'm seeing a rise in systemic candidas, both one that everybody knows, albicans, but also another type of candida that's a little less rare. And I really think you should look at, because if you're that close to all this trash and everything else, gosh only knows what you're exposed to, okay? But it's certainly more.
God does know, Dr.
I know,
Molly.
honey.
Believe me, I don't
know.
think he's pleased.
No, I agree. And I'm going to put you on our prayer list, honey. God bless you, Catherine. I mean
Dr. Molly, you're a sweetheart. I would do anything for you. Believe me.
God bless
All you
you.
got to do is ask.
Thank you,
Thanks
Catherine.
for the call,
Catherine, that's a wonderful call, but
Thank
please,
you.
I'm sorry you're having such trouble. Please, listen to your cousin and get in to see an infectious disease guy, or see him or somebody soon, okay? God bless.
That leads us to what you wanted to talk about.
Right, there it is.
Because you were saying
there it is.
people come in to you,
right,
and they have all kinds of symptoms.
Right, but connecting that symptoms to what the cause and effect is the real challenge, because it can be many things. You see how she said she has a cold that can't quit. That's how we started the conversation. In this case, you could see right away, isn't it funny she has a cousin who's infectious disease and saying, right, because look at this symptoms that she has can be related to many things. But certainly I'd be looking at her environment first and foremost, because you see, Catherine is not just her symptoms. The symptoms can be an indication of several things. She could have something from this house, like even a tick bite, which would be post diagnosed Lyme, which would also be an infectious disease. There's just so many things. When we're looking at symptoms like she has, the autoimmune can give you these kinds of problems. The real key to this is when the doctor and the scientists get together, meaning the laboratorians, and the doctor gets together and says, okay, what's causing some of these symptoms? And hope that we can find that with a little bit of God's help, the big physician, we can find it and then improve their quality of life. Because again, John, I'm going to tell you, sometimes you cannot cure the condition. If someone has an autoimmune condition, the chances are you're not going to be able to cure the autoimmune condition, but you certainly can keep it under control. That's the difference, and improve their quality of life. And that's what we do every day at our place.
You mentioned Candida. Now, what is that?
Candida is a fungus. It's a fungus. Normally, it's present everywhere, right? I mean, you can have it. But I have a particular case. In fact, this is the second case. I had a young man who came in from out of town that I told you about. He had a mold condition. And this patient is a 60-some-year-old woman who I'm treating right now. She also has a particular type of Candida. It's not the normal Candida, if there is such a thing as normal Candida, but one that's more recognizable, I guess is the way to say it. In this case, I really had to send out, and I talk to my physicians, and I encouraged them to do blood cultures, and they agreed with me and did it. And indeed, this patient came back with a respiratory type of fungus that is really quite complex and intricate to treat, because it doesn't respond to the regular treatment for Candida, which is fluconazole. It doesn't respond to that. So we had to actually go and get a different type of antifungal for this particular patient. And let me explain something. These kinds of conditions may well have to be treated with both conventional and integrative, which is why a facility like ours is perfect.
You are never opposed to treating traditionally?
No. When you need to get rid of Candida, you may have to use an antifungal. And I'm not just talking about using some extracts that, gosh knows, I have plenty of, the anti-inflammatory extracts. I'm saying they're good, they're great, but they may not get rid of those spores. We need to get to the heart of the matter. That's when you really got to look to conventional pharmaceuticals. The idea is how to use them. How to use them in a way that doesn't debilitate the patient. Because I'm going to tell you something. When you go into the hospital, and you know this, you can go into the hospital and have these things from infectious disease run into your vein. That's hydration, right? It's run through hydration. But it knocks the heck out of you. How do you counteract that? Well, I believe our protocols help do that.
So you cover all bases.
I try to.
With your protocols.
We try. We use the antifungals, and at the same time, we're going to give the patient supportive care while doing that, so that they then can actually function while they're doing this, at least keep the antifungals working. We don't want to give anything that's opposed to the antifungal. It's the same way we do treatment for cancer support. We don't want to do anything that's going to disrupt what the oncologist wants to do, but we want to do a supportive care that will enhance the patient's quality of life while going through a very tough course of treatment.
We are at the halfway point of the show, and I tell you, I always say this, time flies when you're having fun. It is Health Watch every Sunday, 8 till 9 on Talk Radio 1210, WPH.D. 855-839-1210 is the number here in the studio. If you have a question for Dr. Molly or a medical challenge, 855-839-1210, no matter how difficult you feel your case may be. Dr. Molly will be happy to try to help you out. 855-839-1210 is the number. The show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. I'm your host, John DeMasi. Dr. Molly and I return with more after these words. We are back here on Health Watch, and operators are standing by at Innovative Medical Associates. The number, 856-489-0505. That's 856-489-0505. When you call, pretty simple. You want to schedule that initial consultation with Dr. Molly. It is complimentary. You'll find out a lot about what potentially Dr. Molly can do to help your condition, and you will just be able to make a more intelligent and effective decision. 856-489-0505 and the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. 855-839-1210 is our number here in the studio. Want to give us an update on a few patients,
Oh,
Dr.
sure.
Molly?
Sure I do. So where do you want me to start, John?
How about Sandy?
Sandy, everybody knows that I've been treating Sandy for many, many years. And she has osteoarthritis, very, very severe osteoarthritis. But interestingly enough, she also acquired MRSA, and I believe it was a hospital-acquired MRSA, and everybody knows it. Her traditional doctors know it. As a matter of fact, we sent her to a couple of the specialists. But this is an interesting case this week because she had a wound situation on her foot, and the wound looked infected, and of course we said, you need to get over to the wound care and get that foot looked at. So we did. We sent her there. She did. The wound care people took care of it. They wrapped it, etc. But they told her that they'd have to send somebody else back out to change the dressings, right? So she's waiting around for the person to come to change the dressing because she really has a hard time getting around. She likes to have her appointment scheduled. Well, make a long story short, the particular people called her and said they weren't going to come out to change the dressings that day. So she called my office, and, of course, I'm sitting there with the docs and myself. And I said, Sandy, this is ridiculous. I said, do you think you can get over to our office because we're very close? She said, oh, yeah, I'll get a ride. She comes over to our office, and what do you think happens? My registered nurses, 2 of them, go in there and help change the dressing, repatch her up, wash the dressing, do everything that they would have done for her at home and didn't. And then we actually gave her some hydration. We got her to feel a little better. And the interesting thing is, this is the way healthcare is today. It's like, oh, well, I didn't get there today. We'll get to you tomorrow, the day after. Well, let me tell you something. In my book, guess what? When we're treating something like MRSA, somebody should be looking at it on schedule so that the patient feels safe and that we maintain some kind of relationship with the patient. I've never seen anything like it.
MRSA is pretty serious, isn't it?
Very serious. It's a blood destroyer. It's a very bad bacteria. It doesn't just go away. You really got to be treated with IV antibiotics, which she was. She's done a full course of 2 treatment loads with a infectious disease doc. But here's the deal. Generally, she does pretty well, as you know, because you see her there every week. But this thing knocked her out. But more importantly, she has to have, you don't just wrap up the wound and say, oh, well, okay, we'll change the dressing in 2 days, and then you don't come. I mean, that's not whatever. Like she said, if they told her to come back to the office, she would have done that. She would have arranged to have a ride. But they didn't do that. They said, oh, we're coming to you. And then, they said, oh, yeah, you're on the schedule, but we can't get there today. So that is a true story, folks. And she'll tell you that herself. So that was one patient. The other patient I want to talk to, though, is much more exciting in terms of what we do. You know Joan, and a few weeks ago, you remember me talking about a patient who went up north to a very prestigious facility to get radiation treatment for the cancer that had gone to her brain. Now, Joan has been with me for 24 months or so, and she did very well. She's in great shape, I mean, when you see her. So she did a full course of the radiation. I think it was 7 treatments. And she did pretty well through this. But she came to see me, of course, because during those treatments, I could not give her anything that would interfere with the radiation. So again, cancer is one of those things that it's like Goldilocks. It's got to be just right. We don't want to destroy all the treatments that they're doing traditionally, but we do want to help our patient get through those treatments to get to the other side and have a quality of life. So in Joan's case, she came down, and as I told the folks a few weeks ago, that the doctor reached out to me, the doctor that she had, and said, wow, I've never had a patient in such good shape to take the radiation.
We are going to go to the phones. We have Dolores in Orlando, PA. Hi. Dolores, good morning. Welcome to Health Watch. You're on with Dr. Molly.
Hi, Dolores. How are you? How are you?
I'm fine. I'm a regular listener,
Oh,
but
God bless
you
you.
mentioned briefly this morning about being Italian, and I thought you would love the movie Cabrini.
Oh,
It
yes.
is the most
oh,
inspirational.
yes.
It's
Listen, Dolores, I love that. Let me tell you something. You know, Sister Fran, who's a patient of ours, brought that to my attention this past week and said it is outstanding. Usually, you know, if she recommends something, I try to see it. Where did you saw that in the theater, right? It was in the
I
theaters.
saw that at the Water Tower up in Montgomeryville.
Okay.
And
Okay.
it was so inspirational. I can't tell you. It really made me proud to be Italian.
Oh my goodness, that's I think. And Sister Fran's not Italian, by the way, and she brought it to my attention. In fact, I think I mentioned it to John a few weeks ago.
We did. We talked
about
it.
A little bit about it. That is
Good.
a
Well,
wonderful
I'm
movie.
so glad. I'm glad you got to see it because you deserve a pump in the arm.
Thank you. God bless
Okay.
you. God
You're
bless
very
you.
welcome.
And,
God
and
bless
please
you.
stay healthy, my friend. Stay healthy. God bless.
All right. Thanks for the call,
Thank
Dolores.
you. That's a nice call. Very
Yes.
nice call. So back to Joan. So what, you know, the doctor had spoken to me a few weeks ago, as you know. So she did well. And right now I am following up with her. Now I can deliver some things to it really help her keep the inflammation down because enough time has passed since her last treatment, since the last radiation treatment. And this is what I mean, folks, about going to a place that is medical hydration versus just going to the spas. You really want physicians, and I would say physicians and clinical directors and nurses who actually understand what you shouldn't do for a patient while going through chemo, going through radiation, going through immunotherapies, but what you should do and to help them sail through that and then to restore more of their quality of life when the conventional treatments are over.
It's really important that people see someone like yourself.
Well, not me, but
But-
my
but-
docs, our
or-
facilities.
right.
Yeah, our facility. I mean, look, my docs are wonderful. My nurses are outstanding. I mean, one of my nurses is actually, her background is in critical care. And I have nurses of various degrees, you know. And then you've got to have a nurse like Barbara who really understands the role of nutraceuticals and what they can do, and then somebody like me who understands the science behind the nutraceutical and why I might not use that particular nutraceutical for a patient who's going through radiation.
Everybody has a role. in your
Everybody,
place.
and my doctors have to approve that the patient is well enough to do the hydration and that we're on the road to help them recover and have, more important, we say all the time, we don't cure anything, but we sure give you a quality of life because the whole point of living, and God, I believe God is the ultimate physician, and the whole point of us being here on earth, John, is to do what? To enjoy our time.
And that's very important.
I mean, it's it. You see my
and a
patient.
lot of people forget that.
And you know what's interesting? My patient population runs from early 20s, 18. I just had a young woman who is the daughter of a minister who came in, and she was completely been going everywhere, great institutions in the north, this, that, and the other thing. And here I run an immune panel, and I can see that the gal actually probably has some type of autoimmune condition that's affecting her skin and her overall quality of life. Already started her on a protocol. And this I found in traditional blood work, looking at things like her cytokine panel, looking at things like her lymphocytes and how they're moving, and putting that together with the physicians and saying, okay, this is what I think. Does she have a bona fide diagnosis of lupus or scleroderma? No. But does she have some indication that she has an autoimmune response to her skin and to her smooth muscles? Yes.
So it's really a variety of things that occur in your facility. And
Sure.
you're able to zero in
Right.
on most cases.
Right. What we try to say is we're not going to give you a definitive diagnosis if we can't definitively find it in the traditional blood work. But, you know, there's no such thing as having like a touch of rheumatoid or a touch of diabetes or a touch of MS, right? Some patients come in with mixed etiology. And guess what? They still need to have something help improve their quality of life.
And we are going to take a break right here. It's Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210 is the number here in the studio. And we still have time to take a couple of calls. So if you want to jump in here, feel free, but do it right now, 855-839-1210. I'm your host, John DeMasi, with Dr. Molly Fantasia. We both return with more of today's Health Watch after these words. We are back on here on Health Watch, and again, operators are standing by, and they will be there well after we leave you at 9 o'clock. In fact, they'll be there all day. So feel free to call whenever you want. 856-489-0505. That's 856-489-0505. That's the number. And if you want to call and make the initial appointment with Dr. Molly, it is complimentary. And all you have to do is just do that, and you'll really find out a lot about what Dr. Molly can potentially do to help you. And it's complimentary, as we said. 856-489-0505. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. The show with Health Watch every Sunday, 8 till 9, right here on Talk Radio 1210 WPHT. And we do have time. We've got a couple open lines. If you want to jump in here with a question, 855-839-1210. 855-839-1210. We're going to talk about and this is a problem for a lot of people, overuse of steroids.
Yeah. You know what's interesting? A lot of people who have these respiratory, I'm thinking about this in terms of Catherine, who have these respiratory problems. They go into their family doc, and the doc puts them on, a course of prednisone, whatever. And of course, prednisone definitely, as you know, I always say, there's a place for pharmaceuticals in our life, right? God's given the science to us, and we should use it. But again, it's the overuse of these particular steroids that worry me. I had a patient come into me. In fact, one of the patients that I'm working on, who is a mold situation, a mold case. And how do I know she has mold? I drew the blood cultures to see if it were systemic, and also ran a sputum culture and found out that it was indeed mold. So it wasn't just a cold. It wasn't that kind of thing. Here she was on 2 months of steroids. So, of course, she had the puffiness, the swollenness. She felt irritable. She had everything that would be consistent with using the steroid, and not necessarily the condition. But what was interesting was she decided to just stop it. And that's what she did. She just...
Which you should never do.
Never. How many times have I started this show by saying, please, folks, do not stop any of your medication that you're put on. You need to get advice to do it. You need to talk to one of my docs. You got to come in, sit with the nurse. The doc will have already spoken to her. We can help you get off your meds for the most part. And sometimes we really can't, nor should we. So the bottom line is you certainly should not stop a steroid. So guess what happened? What she had was rebound. So then the actual congestion in her chest, her coughing, all got excessive. It was worse because she stopped the steroids so abruptly. Now, that being said, the list of symptoms she had, John, was unbelievable. It was a list. It was longer than the 10 Commandments, I can tell you that. So it was a list. And what I'm saying is, when we looked at this, we realized that we really had to work with her rather carefully, and indeed we're doing it. And this is why she's on a hydration protocol. We know it's the mold. She needs an antifungal as well as something to hold down the cough. So the doctor prescribed a particular cough medicine that wasn't steroidal in nature, now that she's off of it. And what we're trying to do is get her body back to homeostasis, which is the Goldilocks theory I tell you about, just right. And that takes time. So, John, a case like this takes up a lot of time and a lot of effort.
And how much time in terms of when the patient comes in to see you till the conclusion?
Well, I think she's going to be with me for another 6 weeks or 8 weeks. That's what I think right now, because we're still working at controlling the mold and controlling the symptoms, which are important for her quality of life. So this is the task that we see at hand. And one of the things I want to say is that generally when people come in with that many symptoms, that broad-based symptoms, there's much more going on than just a common cold. Usually it's a mold issue or an environmental issue, or maybe, God forbid, something even more like a cancer or something like that, an autoimmune disease. So you really need to look beyond your nose when you're looking at patients like that.
You had another Joan who you wanted to talk about?
Yeah. Okay. Yes. Joan. Yes. This Joan came in, and she's been a patient of mine for a very long time. She was a blood dyscrasia, blood cancer patient. She came to us, and she's been following our protocol and doing very well. You should see her reports. All of her numbers are coming up to normal, her hemoglobin, hematocrit, and everything. So she's going on vacation, and she had some knee trouble. So, of course, she's a great candidate for what? Regenerative medicine. So, of course, I have a great doc who was an anesthesiologist, and I like to say she's not only wonderful with helping me with the IV treatments, meaning not afraid to put some of these things together, but she's also great with the needle, as they like to say, if you have to put it in your knee or shoulder or whatever. Although, like she said, we're not curing anything, but I'll be darned if some of this doesn't regenerate tendon and also help with tears, small tears. And she herself, was a patient. Dr. Pat has MS and absolutely is a big proponent of regenerative medicine for neurodegenerative diseases, and we do a lot of them, John, now, as well as the arthritic diseases.
I believe Dr. Pat was in a situation where she was considering another business.
Yeah, that's exactly right. She retired. She wanted to retire from medicine. And I told her, you can't let all that knowledge go to waste. And that's exactly why she stayed with me. But I will tell you, regenerative medicine, I am telling you, is here now in the 21st century. And it can be done. And the other thing is, it has to be done carefully. And I will tell you that the hydration therapy that we use with the regenerative medicine makes the difference. It absolutely makes the difference.
How do you know if you're a candidate for regenerative medicine?
Well, if you have pain in the knees, if you have pain in the shoulder, if you have a type of condition that they tell you have no hope for, come in, talk to Dr. Pat. We'll talk about our MS, our protocols for Parkinson's disease and MS. I'm looking at some things right now. I told Dr. Pat and I are looking together at some things for muscle deterioration, those types like ALS kinds of conditions, and we've had several patients. And again, we're not curing any of them, but what we try to do is improve a patient's quality of life. And for that reason, I believe that regenerative medicine is the medicine of the 21st century.
How does it work, though? Can you just give us an overview of how it works?
Well, there are, people all know that in our platelets, et cetera, we have some growth factors. We have factors that can promote new cell growth, that type of thing. So it can be done by insertion of the needle into the area, or actually there are things that we do in the hydration side of the house that can enhance your own cells to come back, and actually they're combination treatments. So there are lots. I would urge people to come in for that. But again, that's for the kind of treatments like MS, Parkinson's, degenerative joints, that kind of thing. So it's not purely orthopedic, but it's a combination of neurodegenerative diseases, certain types of autoimmune diseases, and also the joint regeneration, those kinds of things.
I have a back problem. Is it good for me?
It might be, John. It might be. We have to talk to Dr. Pat about that. The problem is you have too many problems, and we got to take one bite of the apple at a time.
Right. I mean,
more serious problems first, and then, of course, things like the joint problems. Okay, so yes.
Okay, well, that's another thing on the agenda.
All right, you got it.
With that, we are going to put the wraps on another edition of Health Watch. Don't forget, operators standing by at Innovative Medical Associates right now. And they'll be there well after we leave you at 9 o'clock. 856-489-0505, 856-489-0505. And again, the website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and our nursing staff, Barbara, Lana, Donna, Jess, Vicky, and Daniel. And then, of course, there's Joanne, delightful Dee, fabulous Fran, and our medical assistant, Sandra. I'm your host, John DeMasi. Thanks for listening. We'll talk to you next Sunday, Health Watch, 8 till 9, here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.